laser vision correction, Lasik, Epi-Lasik, PRK, ICL, these are some of the procedures available for getting freedom from spectacles and contact lenses. Many people, in fact millions of people across the world, have taken the benefit of these technologies to get freedom from spectacles and contact lenses. Who is eligible for these? How does these procedures work? What to expect from these procedures is very important information that one should know before taking up these procedures.
Nothing is more precious than our eyesight. So much of what we learn, what we experience, and what we enjoy comes to us through our eyes. Millions of people who are affected by nearsightedness, farsightedness, or astigmatism. Laser eye surgery may offer the vision you want without the constraints of glasses, wear contacts to seeing the details of the world around you, or without having to depend on glasses or contacts. With LASIK refractive surgery, this dream can become a reality for those who are nearsighted, farsighted, or have astigmatism. LASIK can be very successful when performed in the right patients, but it is not for everyone because LASIK permanently changes the shape of your eyes. It should only be done on adults whose eyes have finished maturing and who have a stable prescription for at least 1 year. You should be in good general health and have healthy eyes free of eye diseases, infections, and injury. If you are interested in LASIK, ask your doctor for a consultation to determine whether you are a right candidate. The consultation will include special series of tests and a detailed medical history. If you're not a candidate for LASIK, other vision correction options may be right for you. Diagnostic techniques have advanced dramatically over the years, and the surgical technology is now more precise than ever before. During the procedure, a laser is used to reshape the cornea where light enters the eye. This corrects vision by changing the cornea shape so that light is properly focused. The procedure takes only minutes and most people can go to work the next day. As with any surgery, there are risks and limitations, and our team of LASIK specialists can review these with you. Waking up with clear, sharp vision is priceless. It's no secret that the cost of glasses, contact lenses, and solutions can add over the years, making LASIK a smart investment. Laser vision correction can change the way you see the world. Find out if it's an option. When you enter the room where your LASIK surgery will be performed, you will begin by lying down on the procedure bed. Next, anesthetic drops are applied to numb your eyes. The surgeon will then position you properly under the laser machine. A device will hold your eyelids open so that you do not have to worry about blinking or closing your eye during the procedure. The LASIK procedure consists of 2 steps. The first step is creating the flap. To do so, your doctor will separate the outer layer of the cornea, the clear front window of the eye. Your doctor will then gently lift this flap and hinge it back out of the way in order to expose the deeper layers of the cornea. At this point, you may feel some mild pressure over the eye and your vision may dim and become blurry. The second step is performed by a laser that will reshape the cornea for your specific prescription. You might see a blinking fuzzy light. Your doctor will ask you to look straight ahead in order to precisely align the laser beam with your eye. When everything is just right, your doctor will activate the laser. Computer-controlled laser light pulses will remove microscopic amounts of tissue, gently reshaping the cornea. The pattern of laser treatment is determined by a sophisticated program and based on the detailed measurements that were taken during your preoperative examination. The laser light is invisible but you will hear slight clicking sound as the laser gently reshapes your cornea, because your eye will be numb and will not feel the laser, although it's normal to smell a faint odor at this point. Surgeon will gently reposition the flap, smooth it with a special medical sponge, and allow it to dry for a short time. You will receive a shield or sunglasses to cover your eyes so that you do not accidentally rub them. Ask us if you have any questions about the Lasik procedure. But these instructions will ensure that your procedure goes as smoothly as possible. Grab your glasses, you'll need them. Your doctor may recommend you to stop wearing contact lenses in the weeks leading up to your surgery because they can affect the shape of your cornea or affect the results of any measurements. Be sure to pick up your post-operative eye drops from your pharmacy before your procedure and apply these drops as instructed. Also, make sure to coordinate a ride home from the procedure because you will not be able to drive yourself. On the day of surgery, be sure to double-check the surgical center's address. This location may not be where your consultation took place. It's also important to arrive about 10 minutes before your appointment and bring all necessary paperwork, including your consent forms. It's safe and even recommended to eat and take regular medication on the day of your surgery. You should come to the appointment in comfortable clothing. Do not wear any makeup, perfume, lotion, or hair products which could interfere with the laser. Remember to bring sunglasses. In some cases, sun protection may be provided, but having a pair of your own sunglasses is handy. Your eyes may be sensitive to light after the procedure. Following these instructions will reduce the risk of having to reschedule the procedure. In the meantime, if you have any questions, please give us a call. Lasik is a popular procedure with very high success rates. Most people see positive results from Lasik surgery very quickly, but every person responds differently. Your vision may not be perfect immediately following the procedure, and total healing occurs over many weeks and even months, and usually takes longer for far-sighted patients. It's normal to have blurriness, light sensitivity, tearing, and mild discomfort right after surgery. Additionally, one of your eyes could heal faster than the other. By following your treatment plan and attending follow-up visits to your eye care professional can make sure your healing is on track and will address any of your concerns. Dry eye syndrome, common after Lasik due to decreased tear production, your eye care professional may recommend lubricating eye drops or other treatments to help relieve your symptoms. It is common for people who get Lasik to experience halos, glare, starbursts, or ghost images when looking at lights at night. But this is usually temporary. Infection or complications in the corneal flap created during Lasik surgery are rare but possible. There's also a chance that your eyes will heal differently than expected. Not everyone who gets Lasik will achieve perfect vision, and you might still need contacts or glasses. You may even be eligible for an enhancement procedure to fine-tune your vision. It is important to understand the risks and benefits after Lasik. After the Lasik procedure, you'll usually be able to go home within a few minutes, though you will need someone to drive you. It is normal for one eye to feel different from the other and to notice red spots on the white part of your eye. Occasionally, people can see some vision improvement immediately after the procedure, but it is common to experience blurry or hazy vision for the rest of the day. Nearsighted patients and those with astigmatism usually notice considerable improvement the very next day, but visual recovery may take longer for far-sighted patients. In all cases, Vision continues to gradually improve for days and weeks after the procedure. Plan to stay home and take it easy for the remainder of the day. If you have itching, burning, or a feeling of sand in the eyes, closing your eyes for a time can help. If your eyes are sensitive to light after the procedure, you should wear sunglasses during your recovery. Most people are able to go to work and resume normal activities the next day. But if necessarily, you may need some extra days of rest. You will probably be asked to avoid swimming for at least a couple of weeks after your procedure. Though you can generally baby shower or wash your hair beginning the next day, you should try to avoid getting water directly into the eye. But if some dust gets in, dab lightly to dry and do not rub. In fact, it is important not to rub the eye for a month or so after your procedure, as there is a small chance of dislodging the corneal flap. Your doctor may advise you to avoid working in a dusty or dirty area or avoid wearing eye makeup for a period of time after your procedure. Generally, you will return to see your doctor or surgeon the day after surgery for a follow-up examination. As with any other surgery, always follow your doctor's instructions and take any medication that is prescribed to you. It's important to attend follow-up appointments and routine eye exams as advised, so that your doctor can monitor the healing process. If you have questions about what to expect following LASIK surgery, do not hesitate to ask us. Patients over the age of 40 who want to go for laser vision correction typically require reading glasses to help them see up close. This is due to a condition called presbyopia, which causes near vision to blur as we age. Monovision laser correction is a strategy that addresses concerns over the need for reading glasses after having laser surgery. This technique involves the correction of one eye for distance and the other eye for near or intermediate vision. When both eyes are open, the brain can choose to use the distance-corrected eye to see far away and the near-corrected eye to see up close. Many people get used to monovision right away. Other people feel the little imbalance at first, but get used to it within a matter of days or weeks. Some people cannot make the adjustment to monovision and are better off not choosing this approach. Simple testing can help determine if you are a good candidate for this procedure. LASIK and PRK are common laser vision correction procedures, but they do differ slightly. Usually, patients are first considered for LASIK surgery. If you're not a good candidate for LASIK, then PRK may be an option. Both procedures correct vision using targeted laser therapy. However, the procedure and recovery processes are different. To be a candidate for LASIK surgery, patient's cornea must be thick enough. If the cornea is too thin, LASIK can weaken its structure, causing the cornea to bulge. This can result in decreased vision. PRK may be a better choice for some patients with thin corneas because laser does not penetrate as deeply into the cornea as with LASIK. In LASIK surgery, the doctor creates a corneal flap, which is folded back as the laser is applied to the deeper corneal layers. After the laser treatment, the flap is repositioned over the eye. In PRK, there is no flap. Instead, the surgeon removes the outer corneal surface completely to expose the deeper corneal layers where the laser is applied. The deeper layers are left exposed. Eye drops or oral medication or a protective bandage, contact lens may be prescribed to manage discomfort while the other layer regrows. Because of the time it takes the cornea to heal, patients may experience more discomfort and longer recovery with PRK when compared to Lasik. Additionally, PRK patients may have more frequent follow-up visits with an eye doctor to monitor the eye's healing after surgery. Both Lasik and PRK are popular options for correcting refractive errors. The best treatment type depends on your unique needs. Let us know if you have questions about your options for laser vision correction. Your eyes and your vision are as unique to you as your fingerprints. And no two people are alike. Yet, until recently, two people diagnosed with the same prescription would be treated the same. That's because glasses, contact lenses, and conventional laser surgery only address vision problems known as lower order aberrations, which include such conditions as nearsightedness, farsightedness, and astigmatism. Higher order aberrations can result in visual symptoms such as halos, starbursts, glare, and typically cause problems for patients while driving, especially at nights. Now, an advanced form of laser vision correction known as wavefront or custom Lasik takes both lower and higher order aberrations into consideration and delivers a treatment that is based on each eye's unique vision fingerprint. In addition to correcting low-order aberrations, the custom Lasik procedure can help improve satisfaction with night vision by reducing the risk of glare, halos, starbursts, and ghost images. This procedure is the most advanced form of laser vision correction available today.